কি নাম তোমার? নাম কি? হাঁটতে পারবেন? হাঁটতে পারবেন? শব্দ শুনলে বা কোনো কিছু একটু ডাকলে তখন বেশি হয়? হাঁটতে পারবে? হাঁটতে কত বছর বয়স থেকে এমন হচ্ছে তার? 1 বছর। ছোটবেলায় হাম হয়েছিল না? হামের টিকা দেওয়া হয়নি? দিন দিন কি বাড়তেছে? বুদ্ধি শুদ্ধি কেমন এখন? বুদ্ধি কেমন আছে? This is a case of SSP, Subacute sclerosing Panencephalitis. There is Myoclonus. देखिए, बहुत stimulus sensitive Myoclonus. শব্দ করলে বেশি হয় না? আর শুই থাকলে বেশি হয়। আর এই শুলে মাথা এইভাবে দেখতে পারে না, এইভাবে আসলে কম হয়, শুলে বেশি হয়। আর ওই কাট কুট দিলে সানা অল্প হয়তো দেখো। SSP, Subacute sclerosing Panencephalitis, is a chronic, rare, progressive fatal encephalitis. Usually develops 7 to 10 years after measles infection. It is caused by immune resistance measles virus. It is a fatal encephalitis, and it is diagnosed with some neuropsychiatric manifestations. Patient is classified into 4 stages. In stage 1, patient usually develops some lethargy, decrease, there is school performance is decreased, and some psychiatric manifestations. But in stage 2, patient presented with extensive myoclonus, frequent myoclonus, and also there is a decrease of the cognitive function. Stage 1 usually patient in this stage usually persist or sometimes years to months to years, but stage 2 patient usually persists 3 to 12 months usually, but it varies. And in stage 3 there is also deteriorations of the neurological deterioration of the patients, and myoclonus are decreasing. And stage 4 there is patient is in vegetative state, and it is very fatal. It is diagnosed clinically along with some investigations. In CSF we can get increased protein and gamma globulin, and also anti-measles antibody. In blood we also can get anti-measles antibody. And EEG there is periodic synchronous and slow wave complex. It is very pathognomic of Subacute sclerosing Panencephalitis, but it can develop in other cases also. And MRI sometimes help, but it depends upon the stage of the patients and condition of the patients. Sometimes the MRI is normal, but in acute stage patient we can get there is hyperintensity in the parietal and temporal lobe asymmetrical. In extensive stage patients there is also involvement of the basal ganglia and corpus callosum, and but it's not pathognomic or not conclusive. And it is no treatment still, is no curative treatment for SSP. Some immunomodulating agents are used like isopenicillin and immunoglobulin, and some drugs like amantadine, antiviral drugs like ribavirin. Ribavirin can be used for SSP, but no curative treatment is still found. And there's one case report. In case report there is in low resource country we can use levamisole, anti-helminthic drug for SSP, and they show it's a dramatic response to SSP. Along with these medications, conservative and supportive management like antiepileptic drugs like carbamazepine, valproate can be used to control seizure and also the myoclonic charge. Still the prognosis is not good. The patient is usually fatal. and that's all. Thank you. In this case we got the patients, he is in stage 2. We tried isopenosine along with levamisole and antiepileptic drugs like valproate for these patients, and we will update the patients about his symptom control. Thank you.